Hi everybody, I wanted to talk today about ARD, which is adhesion related disorder. My name is Ashley. Unfortunately, I have ARD, which is why I know so much about it. First, I want to talk about adhesions. What exactly adhesions are. They are like bands of tissue that grow inside the abdomen and connect to organs, and then can connect to the inside of the abdominal wall. It can connect to other organs. And pretty much it's very, very painful thing to experience, and it's non-discriminatory, so men and women can both end up getting it. The main cause is through some type of abdominal surgery. My first experience with adhesions was when I was 21. I had my first C-section with my oldest son, and about 4 months after I had him, I started experiencing a lot of pain. Could not exactly figure out why. My doctors were running tests and whatnot, and they could not find the cause of the pain. So we had decided, you know what, we're going to do a laparoscopy. We're going to go in and we're going to look, see what's going on in there. During the laparoscopy, they went in through my belly button with a camera, and they had said if they had to fix anything in there, they would make a 2-inch incision near my C-section scar, and that's where they would go in and actually fix whatever issue they found, if they found one. They had found during the surgery that my uterus was attached to my intestines with these bands of adhesions. So they removed the adhesions, they stitched me back up. It was about 3 days recovery, and I felt much better. I didn't have any more pain, no more bathroom issues or anything like that. So I was pretty good until 2010. I had a second C-section with my youngest son. We had used a product called Zebrafilm, which is like a gauzy material they will put around an organ during surgery to protect it during the healing process. They had used it on my uterus in attempts to keep my uterus from getting stuck to my intestines. We were pretty much trying to prevent that. And I figured, you know what, this is going to be good. We use the material, I'm not going to have any issues. I had went for about 6 to 8 months feeling fine after my C-section, and then I started feeling pain again and wasn't really sure why, and it just kind of continuously got worse. So as the pain got worse, my doctors had decided, put me on some type of pain management, try and keep me comfortable while we start doing more tests to try and figure out, what's going on. I had told them, the pain was very, very similar to what I was already experiencing before, and I was pretty convinced that I was having an issue with adhesions. So my doctor decides, you know what, why don't we just get rid of your uterus? It seems to be the main cause of the adhesions growing. It'd be better to just say goodbye to it. At that time, I was 23 years old. It was a very hard decision for me to make, to get rid of my uterus. I wanted a big family, and I argued with my husband and my family. It was really, really a tough time for me. But ultimately, I had to decide, what my quality of life was going to be, because adhesions, not only are they painful, tugging, pulling, burning sensation, it fatigues you, it makes you exhausted, just like any kind of pain would. So I decided, you know what, if this is going to be the best thing for my family and for my health is to get rid of it, then it's what needs to be done. So we did the surgery, and I was told it's going to be about 40 minutes long, quick, in and out. Recovery is going to be similar to a C-section. Great, no problem. So we go in, and what was supposed to be 40 minutes turned into an hour and a half. They said that once they got in there, they found that my uterus was completely attached to my bladder, which made a lot of sense because going to the bathroom was very painful at that time. Internally, it was just extremely painful. So the recovery for the hysterectomy was a lot like a C-section. It was just a little bit longer, a little bit more painful, because them having to mess with my bladder and whatnot. It made the recovery a lot harder. So after that was over, I felt great again. My energy was back, and doing stuff with my kids. I'm able to run and pick them up again, and it was really, really great. I was really excited to feel back to normal. So I felt great for, like I said, quite a while. The hysterectomy was done when I was 23. It was a month before my 24th birthday. So by the time I was 25, my early 25th birthday, I started experiencing pain again. And I'm so devastated by it. I'm I cannot believe that this is happening. How can this happen? I don't even have a uterus anymore, and I lost one of my ovaries, one of my fallopian tubes, because of ovarian cysts. It had to come out. So I'm just what in the world is going on? So we do tests, and they're like, oh, you know what? Maybe it's your gallbladder, which didn't make sense to me because the pain that I was having wasn't anywhere near. It wasn't up here. It was, low. And they said, sometimes that happens. Sometimes you'll have an issue with one organ and it will hurt in a different spot. And I completely bought into it, and I'm thinking, you know what? It's my gallbladder. We're going to do this test. It's going to come back positive. We're going to get rid of my gallbladder, and life is going to go back to normal again. So the test came out negative, and I was pretty heartbroken by it because I figured that would be the easiest thing to fix. So after more tests and more doctors, my doctor, who's actually an OBGYN, and he specializes in women's reproductive organ issues and pelvic pain and stuff like that, has said, he was well, we're going to bring in a general surgeon. He goes, because maybe you have incisional hernias. You've had 2 C-sections, a hysterectomy, and a laparoscopy. All your scars are in the same spot. The muscle could be weakened, and your intestines could be coming through. The only way we can see that, though, is through a laparoscopy. Okay, great. No problem. Let's do this, and let's get it done. So, during surgery, they went in, and they found that just about all of my organs had adhesions on them, which was really frightening that, less than 2 years had gone by and I had that many more adhesions. So, I was told before my surgery, we're going to go in laparoscopically. If we have to go in and do any kind of surgery, you'll have probably the same scar as the C-section. We will remove the other scars that are there, just to keep that part of my body uncompromised, just to keep me from getting any hernias. It's alright, no problem. And the best part was